So tell me who you are.
So my name is Loricka. I am from Parker Health Group.
Perfect. And what do you do?
I am the Informatics Nurse for the organization.
And what's an Informatics Nurse?
So it's a very unique role. It basically comprises of a lot of technology and data. Basically my role, I admin, so when I say admin, I am the subject matter expert for the EHR system for the organization and any other clinical applications that we use to provide care for the resident. That includes hardware and software. So anything from a Vitals machine that's integrated or non-integrated or standalone, but it is a application ran solution, I support that in all aspects of it. I also support the data, accuracy of the data from the different data sources, compiling the data, and again using Power BI through Owl as well to deliver those data where we can action it and just really action it and drive better outcomes out of it. I also do day-to-day interactions with the staff, troubleshooting. So I go around answering questions, looking at the physical hardware of items that have issues with it. In addition to all of that, I do have work that I do with direct vendors, like for point-click care, whereas I keep on top of the best practices, regulation changes, and I am an element of the QAPI for the organization. So my role involves a little bit more than that, but that's like a little bit of synopsis of it.
Okay, cool. So what I'd actually like to have you do is talk to me a little bit about what are your sort of, how do I want to ask this question? What are the favorite data things that you like looking at?
So I love looking at specifically quality measures. I like looking at the state, national, and at Parker we have our internal quality measures where we set our internal benchmarks. So I'm always looking at those three areas where I'm looking at what we're looking at and what the state and national is looking at in terms of, say for instance, falls. We look at falls, all falls in total numbers at Parker, and we set our benchmark. And we also look at falls that are level 3s, so reportables. So we look at that separately. So I like looking at that and looking at the comparison and really delivering that to the leaders and then making, having them make good choices of what things that we're going to drive from that. So fall solutions, for instance. If we have one and we're seeing increased falls and it's not performing, then we need to start looking for other solutions to sort of engage in, as we're not seeing good results with the one we have. So that's kind of the data that gets me going.
Cool. So can you give me an example? You've talked about falls a little bit already, but can you give me maybe a specific example of how you used data from your OwlHealth, examples of where you've used your Owl dashboard data to improve the lives of either residents and or team members?
So that would come back to the famous UTIs. The collection of urine samples is what, we tend to look at. In our views, we are looking at all of the samples that was sent out to the lab. It allows us to analyze that. Why are we sending them out to the lab? And in many cases, did the doctor order an antibiotic prior to those results coming back? And that is very important as we analyze it. So we look at the data, how many was sent out, we look at the results of that right on that view, and then we look at the antibiotic that was or was not ordered for that resident. So sometimes, we have on-call physicians that are not really familiar with the resident as the attendant, so then the antibiotic may be ordered as we're waiting, and we find that when we do find those cases very easily because the data is so available, we call in ID and we make changes, and that help us really with our antibiotic stewardship program. definitely it helps. So that's one of the other areas. There's a third area in there that I really like as well, where it comes to medication errors. So we're also pulling down risk management in there, and it allows us to look at commonalities and look at the gaps where we need to educate on. So with med errors, if there is, say, something like something simple as maybe a parameter associated with a medication, if we see a med error, so I'm looking at all sites, if I see a med error that has a commonality in one or two homes trending in that direction, then we know we need to re-educate staff and put something else in place to prevent that from reoccurring. So it allows us to, make big improvements across the homes where commonalities are found and share that information. And where we share that is at our clinical steering committee meetings. So even though individually we're looking at our own data at a home level, but again, we still share that where we find commonalities and make improvements on it.
Thank you very much. That was really, really good. I appreciate that. I love what you're doing.
You're welcome.